Hi, how are you doing today? This is Dr. Janson, and I want to talk to you about what we call in the practice here injury season. Injury season is May, June, and July, and suddenly on top of our regular practice of people coming in for their regular problems, all of a sudden we get a lot of phone calls and emails and people contacting us because they've hurt their foot or ankle. And the reason why they hurt themselves at this time of year is because they're doing something different. So sometimes when the weather gets nice, they'll go outside and do sports, running, taking their bike out finally. You know, it's finally not cold and raining all spring, so the sun comes out and they want to get their bike out. Or running or taking their boat out. They're just doing a lot of different things, so they wind up wrenching their foot or their ankle. So that makes sense. And if you're going to start running, you should warm up and start slowly, and make sure your shoes, don't use the old shoes from last year. Make sure your shoes are good, stuff like that. But that's kind of common sense. So I didn't really want to talk about that. What I wanted to talk about was the other type of injuries, which is people that are traveling or doing something suddenly different somewhere, not at their home, but somewhere else, like visiting a relative, say. So next year I'll be treating patients for 40 years. And I started treating patients in the school clinic, before I graduated. So next year will be 40 years. So you can bet I've seen pretty much everything and anything that anybody could do to their feet. Certain injuries that people get while they're traveling that I've seen before are lots of people yanking their luggage around in an airport. So the airport is really long. You have to walk like a mile before you get to your gate. Or you make a connection in some like Caribbean country or something, and they say, oh, the plane's out there on the tarmac. And quick, it's leaving, you got to run. So you're running with your wheelie thing, and you're kind of like turning and pulling on this thing, and patients wind up wrenching their feet, so they could get an avulsion fracture or tendonitis from doing that. And that I've heard a lot, patients wrenching their feet, pulling the heavy luggage quickly, and for a long distance. So try to, if you could budget time, and also, switch hands maybe with the luggage. Also backpacks. Have your onboard luggage. Now they have a lot of very nice backpacks, instead of a wheelie thing. So that might help too. So just be aware of yanking luggage around. That could hurt your feet and ankles. Also, patients rent equipment. They rent a scooter or a bike or parasailing or whatever. Like, for example, I've seen a lot of patients that rent a scooter and then they're driving it to the beach. And, you can't drive those things on the sand because the wheel pops out, and then they put their foot down and, that's it. So, be careful renting equipment that you're not used to. And that scooter, you can't drive that in the sand. Like, don't do that. What else? Oh, they go in the ocean, then they go in the ocean, and then they're on rocks, and the rock is moving. So that's another way. I've seen a lot of broken bones by patients foot flipping. And then I get an email with a picture, and the foot looks bad. And they say, oh, Dr. Janson, look at this picture of my foot. What happened here? So let's say you hurt yourself and you're in some foreign countries. So, with cobblestones, I forgot to say, people walking on cobblestones can also have a stress fracture, from walking 2 days, 3 days straight on cobblestones. Bring your best shoes with you, shoes with shoelaces, like really sturdy walking shoes when you're walking so much, especially on uneven surfaces. Okay, so what happens if you hurt yourself? So all of a sudden you were doing something and you get back to your hotel and you're looking at your foot and it's swollen and it looks bruised. So what I would recommend you do is go to whatever urgent care or hospital ER they have and try to get an x-ray, and find out if you had a fracture. Because like I said, the patients that stood on that rock, they just went just a little bit and man, they broke their fifth metatarsal, really serious fracture. So get an x-ray, and then they'll give you like a boot or crutches or something, you know. So try to treat it right away by going to the local emergency room. And then, you know, if you're my patient, you can contact me, or if you have your own podiatrist, you know, contact your podiatrist and say, you know, can you give me some advice here? So RICE after an injury is rest. Like, you know, they go off, you know, on that walking tour. You're going to stay in the hotel the next day, you know, and you'll just sip pina coladas or something, you know, sit by the pool. R is rest, and I is ice, you know, put ice on it. C is compression, so that's like an ACE bandage or something. And E is elevation, so put your foot up. So you're on the lounge chair and you're going to put like the beach towels underneath your leg, you know. So elevate. So use RICE when you hurt yourself, you know, and you'll come home and then you go see your podiatrist, and the podiatrist will treat it. Now I want to go over a case study that happened. So I just got a photograph sent to me from someone who was away in Europe, and they sent me a picture of their foot, and it looked really bad. Now what happened was the patient there was a hot tub in the room, or whatever, you know, those big bathtubs with the jets. So the patient, so the water was probably spraying all over the place, and there's soap and bubbles and whatever. You know, you come out and then that soap is very slippery. So the patient slipped coming out of that big bathtub thing, and then her foot got really swollen and painful. So the next morning she took a picture of it and emailed me the picture. So I could tell right away that looked really bad. It looked like a fracture to me. So I told her to go to the ER of the hospital, and so she did, and they noticed that, I'm trying to remember if they said, oh, they weren't sure if she had a fracture, I think. But I told her to get crutches and put a bandage on it. So she did. She put an ACE bandage. And then she came back to me, and we took a series of x-rays. And it turns out that she had broken the bone in the midfoot that connects to your ankle bone. So it's a pretty significant fracture. And the tendon had pulled a part of the bone off. And that's called an avulsion fracture, you know, where the little piece gets pulled off. Now, interestingly, I had seen another patient who had this exact same injury, a young fella. He was 29, 30 years old, and he had the same exact injury, but he had it 2 years before, and his foot was swollen, and he ignored it for a while. You know, of course, you know, your foot you wrench your foot, and you're like, oh, I sprained my foot, but it'll get better in a week or two, you know, and a young person would certainly think it's going to get better. So he let it go, and then after a month or two, it wasn't getting better. So then he went to have it treated, and then it was difficult to see the fracture because it was sort of healing, you know. So it was the same exact fracture. So the young fella, I saw him after 2 years of having the fracture. So I actually had to like start treating him with casting, even though he had broken it 2 years before. And then I had the other patient who's an older patient who knows me for years, luckily, you know, contacted me right away and sent me the picture. And so we treated that right away. Now I want to talk about treatment. So you go back to the podiatrist. The best way to treat an avulsion fracture, whether it's that fifth metatarsal avulsion fracture I told you about, the lady on the rock, that one, or a avulsion fracture on the other side, which was the navicular, that was the bone that was broken with those two patients. I would say the best way to treat that is with a soft cast, because the soft cast is very gently compressive, so it gets the edema out of the foot. So when you're talking about a fracture where part of the bone is attached to either a ligament or a tendon, it means that when the foot's moving, the fracture could move. So a soft cast is very nice because it puts like a gentle amount of compression on the fracture site and slows down the movement of the ligament or tendon, you know, so there's no disruption of the two pieces of bone, and they're going to heal a lot faster. I would say it's, you could use a hard cast. I don't think too many doctors use a hard cast anymore. They're hard to get off, and they really don't work better than a soft cast. What will happen is when the foot is not so swollen, the foot will then get smaller, so it'll kind of move around in the hard cast. Where the soft cast actually, which is put on weekly or every 10 days, a new one, you know, it has more contact with the foot, so it works better when the foot gets smaller. It's still stabilizing the foot. So I really like a soft cast. That's my favorite. It's also called an Una boot. That's the old name for it. Dr. Una invented the soft cast. So, but Una boot, it could also be called. And then some kind of like surgical shoe or a boot is important. Not a boot without a cast, because it's the same problem as the hard cast with the cam walker or walking boot. The foot's moving around inside. So, it's going to heal with that, but it's going to heal way, way slower that way. With the soft cast, it's going to heal, the fastest. So it's going to heal in 6 to 8 weeks, a fracture like that. And it heals very predictably well with the soft cast. So this is me putting the soft cast on the patient that just broke her foot in Europe. And this just happened, so she's just healing up now. The foot's looking much better. The young man who broke his foot 2 years ago, he's doing great. His foot finally healed. And this was somebody who was coming and he could only walk with crutches for 2 years. He couldn't put any weight on the foot. Can you imagine that? So terrible. So don't be like the young patient, be like the woman patient. She was good. She contacted me right away, and I told her to go to the emergency room, and she got an x-ray right away. And she's about at week 4 now, week 3.5. So it looks to me like it's going to heal in about 3 more weeks. So she's going to heal up in 6 weeks. And I was joking around with her. I said, look, this, in a year, you're going to forget which foot it was that you broke. In other words, there's no consequences to it. So I hope this video was helpful. So if you go on vacation, just be careful. It's like you're parasailing or doing these weird things, zip line, patients zip line. Boom, and they hit that platform, with their feet. You got brakes on the zip line. Go slowly into the platform. You're not Tarzan. What are you doing? Be careful with that, because you're not used to doing these sports. So that's how patients hurt themselves. They're doing something weird. Somebody talks you into it, and listen to the instructions. They tell you how to use the equipment. Listen very carefully and try to, use the equipment as they're telling you to do it. What else? All right, I guess that's about it. Just don't hurt yourself. Like, go and have fun on your vacation. Don't break your foot. Just be careful. My mother used to say when I was a kid, we would go outside and she'd say, look, if you're going to fall, I want you kids to make sure you fall on your head, because you're Swedish kids and your heads are very hard and they won't break. And we always wondered, we'd go outside, me and my brother, to be like, what did Mom mean by that? When you're going to fall, go for your head. And then, of course, now I realize, if you had time enough to think, to aim for your head, you're never going to want to aim for your head. You're going to stop yourself from falling. You're going to be careful. So that my mother really was saying, be careful. So that's what I'm telling you, aim for your head, not your foot. All right, hope that helped you. Like and subscribe, and I'll see you in the next video.